The Ruby Princess has shadowed the coast of Sydney ever since its controversial return to port more than a week ago. Hi, June. How are you feeling?
I still feel stressed.
June Hardimon and her husband Ray were among the thousands of passengers who came ashore that day.
It was an engagement present for my grandson and his fiancée.
After she returned home, June began feeling unwell.
I felt nauseous a few times on and off and had a few temperatures. I am an asthmatic and I have a lung problem. She said, you're at high risk. So that's what we did. And then the next day I got the results to say I was positive.
The news came as a shock to 74-year-old June and husband Ray, who is caring for her.
With this virus, it's something that cannot be played around with. And me being at high risk, of course it has caused a lot of stress in my body.
I'm very worried about my parents. I haven't been able to see them after they came back from this cruise. And all I want to do is hug Mum and Dad.
In an email exchange with Princess Cruises the day before the ship docked, their daughter was told, "We have a ship full of healthy guests and healthy crew. There are no coronavirus cases on board." 7:30 asked the ship's owners, Carnival Australia, when the health situation changed. The company didn't respond.
I was told that there was no one on that cruise ship with COVID-19 or ill passengers. They were herded off the Ruby Princess like cattle. Passports were not checked, ID cards were not checked.
I found it was very frightening because I thought one lady on the ship had died and that upset me and I thought, well dear, I don't want to be the next one.
The 2,700 people on board have now spread far and wide, returning to homes in Wollongong, Port Augusta, Darwin, Melbourne, Moreton Bay, and even abroad to the United States.
Closed environments where people mix together intensely, such as cruise ships, prisons, aged care facilities are all at high risk for outbreaks, and when those outbreaks happen, they tend to be more severe than outbreaks in other settings.
Passengers from 3 other cruise ships also disembarked in Sydney in the last 2 weeks. Karina Rogers and her daughter were on the Voyager of the Seas, which arrived in Sydney on March 18.
It started out really good. Everyone was happy, everyone was drinking, there was music. We had a great time.
During the cruise, they met Gary Kirstenfield and his wife Jenny.
5 o'clock every day, we sit at the same table and they were just another couple with their daughter. Gary was funny, he was always had something to say, always smiling. Really just he had a lot of personality.
Last week, they turned on the news and were shocked to discover that Gary had died in hospital days after testing positive for coronavirus.
It didn't really hit home until last night when we heard about Gary, because there's a death on the ship now. Like, that's how quick this has spread.
Karina now has coronavirus too.
But it was a big shock because I thought, what am I going to tell people?
While the Voyager was still at sea, it was rerouted to the Port of Eden on the southern coast of New South Wales, a community heavily affected by the summer bushfire disaster.
We have one district hospital which has a handful of anaesthetists, a handful of ventilators, and it's not equipped to deal with a mass outbreak.
Merimbula GP Jacqueline Brown campaigned with 40 other local medical practitioners to oppose the cruise ship's arrival. They succeeded, and the ship was diverted to Sydney.
I think we had a near-miss situation that we were able to foresee that this posed a risk to our community. I still feel sick to my stomach that we transferred the problem to Sydney.
Anywhere where those passengers went, there is a risk of outbreaks taking off.
New South Wales Health did not respond to 730's questions about the decision to reroute the ship. A spokesman for the Department of Premier and Cabinet said that the Police Commissioner is now managing cruise ship passengers.
I can say the federal government has, either late last night or early this morning, issued notices to any cruise ships in Australian waters to return to your port of commencement.
Bronwyn Meredith is doing everything she can to support her parents from afar.
I hope Mum makes a recovery. I don't want to lose my mother. I don't want to lose my father either. This is breaking my heart every day. And I have to be strong for them.
Classical pianist Amber Hammond never thought performing on a cruise ship could see her locked up in a Sydney hotel room for 2 weeks.
What essentially was meant to be a 10-day working holiday, I guess you'd call it, turned into a nightmare that just doesn't seem to have any finish line.
After arriving from Hawaii on Thursday, Amber and other passengers from the Norwegian Jewel were brought to the Swiss Hotel in Sydney. The ship has had no confirmed cases of coronavirus.
So this is day 2 of quarantine, and it's getting pretty harrowing actually, hearing the sounds of some of the people in the rooms next door yelling and begging to be let out of the room because they're desperate for fresh air.
Why are you keeping me stranded in here? You have no idea! You can't keep people locked up in their rooms!
No, we need
They've given nothing!
sunshine.
Yeah. Sunshine, air!
Exercise.
I can't even get fresh air!
Amber says she's doing okay in hotel quarantine, but is deeply concerned for elderly people in nearby rooms.
There's a number of older people on their own, and then they're really suffering. I can hear people down the hallway crying, and there's a woman who's hysterical and pleading to be let out, and she's having panic attacks. Her husband's distraught. There's people who need blood pressure medication, cholesterol tablets, insulin, and they're calling me and they're asking for help, and what to do?
New South Wales Police told 730 all those in quarantine have access to medical care and all dietary needs are being met.
After she left to perform on the cruise...
Amber's other concern is being separated from her 17-year-old daughter.
And I just can't believe that it's considered okay to keep a mother away from her child like this.
States and territories will be quarantining all arrivals through our airports, in hotels and other accommodation facilities for the 2 weeks of their mandatory self-isolation.
This is not an ideal situation for anyone to confront, and it was certainly not the government's preference to have to go down this road.
Adam Cameron Scott worked with the Rudd government in 2008 when it revised and tested Australia's pandemic preparedness plan.
The reason why it's been necessary, though, is because we've heard of too many people that have not been doing the right thing, and they've continued to move about the community, potentially spreading the virus even as they go. And what we're trying desperately to avoid is widespread community transmission of this virus.
And we're a bit worried about using the air conditioner.
Dr Jenny Corson and her husband, Dr Robert Rattray, are concerned they could end up actually catching the coronavirus while under quarantine.
If we were at home in Melbourne, in our own home, we'd be far less risk of getting the virus than we are in a hotel with food that's prepared by other people and lots of people walking around in the lobby, and we're transferred from place to place.
They were among a group of doctors who arrived in Sydney on Friday evening after a month-long medical conference on board a cruise ship in Antarctic waters. She and her partner are now at the Intercontinental Hotel in Sydney.
When we reached the hotel, the police were with us and they took all the details of the people who were staying in the hotel, their personal details and their flight numbers. The police assured us that we'd be able to fly the following day. We're being led by...
Jenny Corson says her group arrived in Sydney 24 hours before the forcible hotel quarantine period was due to begin and were given permission to leave.
They understood that they were free to leave, and they were keen to get home as soon as possible. They were all intending to go into isolation at home for 2 weeks, as we were.
They and other passengers have since been accused of ignoring quarantine orders and attempting to abscond from health officials. In a statement, the New South Wales Police Commissioner said the doctors were another example of members of the community who have not listened to the advice of the government. Jenny and her husband deny they ignored official advice and say they were preparing to go into quarantine at home.
I think it has to be done. I understand that. We just seem to have been caught somehow in some sort of time warp in a period in which we should have been able to go free, but we were held by the government in hotels for a reason we don't really understand.
The measures were announced and implemented rather quickly. So there's a lot of discussions that have to be held before you end up getting a hotel to agree to this type of situation. That's probably why we've seen a few glitches.
This is our gilded prison, pretty much standard upmarket hotel room, huge bed, some pretty nice city views outside the window.
Not everyone is upset with the hotel quarantine arrangements. Many are just frustrated and bored.
7:20 in the evening and we've just had our first dinner delivered to our room, a green chicken curry. I'm happy with the decision that the Prime Minister made to get us here, and I think I understand why he's done that. I reckon we can probably last fairly well for 4 or 5 or 6 days. After that, we might be scratching our heads and wondering what the hell we're doing here.